Plastic and Reconstructive Microsurgeon at Plastic Coast Clinic. Today I'm going to explain a very simple concept about microvascular anastomosis and free flap surgery. So microvascular anastomosis is essentially joining small blood vessels, usually of the size of 2 mm or less. Blood vessels means artery and vein, which supply blood to our body parts and take back blood. So these arteries and veins are joined using very fine sutures and very fine instruments, and since they are so fine, we need some amount of magnification. This magnification is provided by using loops which are attached to our glasses or using the operative microscope. Once these blood vessels are joined, the circulation is established or restored to a part where there was no circulation. Now, free flap surgery revolves around the microvascular anastomosis concept, wherein we take a tissue. Flap is basically a thick mass of tissue which includes the skin and subcutaneous tissue. Sometimes it can include the muscle, sometimes it can include the bone, depending on the requirements of the defect that we are reconstructing. Now, this flap or piece of tissue is taken from one part to the other, and when we harvest the flap, we make sure that the blood vessels supplying the flap are along with the flap. We transfer it to the tissue to the place where it is required, and the blood vessels of the flap are then attached to the blood vessels of the native area. This will now restore blood flow into the transferred tissue, and that's how the transferred tissue will settle in the new area and heal completely. So this is called microvascular tissue transfer or free flap surgery.